So the second major medical procedure in any surrogacy journey is the medical procedure to get the surrogate's uterus ready for embryo implantation. And just like any other frozen embryo transfer, if you, for example, are an intended mother and you've done IVF yourself and tried to do a frozen embryo transfer, the same thing happens with the surrogate. There's essentially no difference between a frozen embryo transfer of somebody versus with a surrogate. And there are two main methods to frozen embryo transfers. So you can either do it naturally, where the fertility clinic is going to track the surrogate's natural cycle and then time the embryo transfer according to her natural cycle. And so in this case, the surrogate's endometrium lining is going to thicken just normally as it does, and the follicles will be monitored and the ovulation will be triggered, and then the frozen embryo transfer will happen the week after. Or the intended parents and surrogate might agree on hormone replacement therapy, which is your more traditional frozen embryo transfer procedure. And here the injections will be given or other types of medication will be given to the surrogate in order to time the embryo transfer according to the fertility clinic schedule or any other schedule that works well for the intended parents. So it doesn't matter whether or not the surrogate does a natural cycle or a hormone replacement therapy cycle. No matter what cycle she decides to use, she's going to have to do these progesterone oil shots, PIO shots, about 5 days before the scheduled embryo transfer and up until the end of the first trimester. And these shots are serious. They are intramuscular, so they are very long needles that go somewhere in the backside, as the picture suggests. And in addition to these PIO shots, surrogates will most likely also take estrogen pills. So the PIO shots are used to help improve the chances of pregnancy, and they are useful until the placenta forms and establishes its own blood supply to the fetus. As I discussed in Chapter 2, embryo transfer day is usually a day of celebration. The procedure itself is very simple, the procedure of implanting the embryo to the surrogate's uterus. It takes about 15 minutes. Most of that is just safety precautions. And all that happens is that a catheter is placed up into her uterus, and the embryo is placed in the catheter, and the fertility doctor pushes the embryo right into the spot where the doctor thinks is the best chance of implantation. Any woman that is doing a fresh or frozen embryo transfer will usually be advised to keep it easy, to take it easy for the rest of the day after the embryo transfer occurs. And so the doctor will tell the surrogate the same thing in this situation and just kind of relax and watch Netflix. So this is something that I didn't go over in Chapter 2, but is really, really important. And no matter which social media outlet you look into about surrogacy, everyone always warns surrogates or anyone thinking to become a surrogate to do research to make sure it's something that they want to do. And one of the reasons is the risks. So a lot of women who decide to become surrogates do so because past pregnancies were easy for them. But it's important to know and to realize that not all pregnancies are easy. And so this is why there's a lot of emphasis in surrogates doing research. And one of the major reasons is to be aware of the risks for the surrogate. So the risks to prepare the uterus for embryo transfer are usually minimal. The PIO shots are painful, but they rarely cause significant problems in themselves. However, pregnancy in general is risky, and this is more so the case in IVF pregnancies. So we know that in all pregnancies, they affect the woman's immune system response, and some women respond worse than others. So many women, when they're pregnant, are more likely to catch colds or catch the flu, and so it's very important to be careful during pregnancy. Compared to normal pregnancies, IVF pregnancies are also more likely to be with multiples, twins or triplets, because usually you have a higher chance of transferring more than one embryo. They're more likely to end early because babies conceived through IVF have a higher chance of being born early. And IVF singletons are twice as likely to be born prematurely as singletons conceived naturally. IVF pregnancy are more likely to cause preeclampsia, which is high blood pressure, and IVF pregnancies are more likely to experience bleeding in the first trimester. So these are just important things for anybody to keep in mind if you're an intended parent, and especially if you are thinking about becoming a surrogate.